All right, so the point of me being up here is that I'll introduce myself and then I'll talk about the Excelsior Surgical Society. So I'm Gordon Wisbach, general surgeon, bariatric surgeon, and I just recently retired 2 years ago from the military after 24 years, and largely was based out of San Diego, and I have the pleasure of still working down there. So what I want to talk about is, again, the Excelsior Surgical Society and talk about how that formed. And the military committee here at SAGE is actually a big part of that. So back 2014, the American College of Surgeons and the military health system had a handshake deal to have a strategic partnership. So that strategic partnership started in 2014, which meant that there was going to be this relationship between the two organizations. There'd be funding, and the main emphasis was to have the partnership support trauma training, try to decrease the walker dip. So that's the learning loss, lessons learned loss after wartime, and doing that through training, research, and military-civilian partnerships. So that started, again, in 2014, and then Excelsior is the military chapter within the American College of Surgeons, and I serve as the inaugural American College of Surgeons governor for that body. So that's what brings me up here. That's the hat I'm wearing here as I stand before you. So in 2015, we had the first Excelsior Surgical Symposium at the American College of Surgeons, and one of the I was very involved with designing that program, and we felt strongly that the consultants, so if you're active duty, or even if you were prior active duty and it's sometimes hard to get in touch with your consultant, particularly when you're on the West Coast and they're on the East Coast and so forth. So we had all three branches of the services represented, and then also keynote addresses. Region 13, which is the Committee on Trauma competition, it was presented there. We felt very strongly that residents and junior surgeons needed to go and have topics that they could relate to, so we had lessons learned from deployment in different scenarios, really great. So over the years, it's grown. The Excelsior has grown. We have two of our members, officers. Captain Tamara Worlton is the Navy rep. Has held a position with Excelsior. And Lieutenant Colonel O'Donnell is involved with the chair of the mentorship committee. So there are many committees, membership, mentorship, research, diversity, inclusion, and a couple others. And so there's a lot of activity with Excelsior, and that's gone on over time. And so the question has been, what's the relationship between Excelsior and SAGES? SAGES being the initial group we were approached as to how to bring together the three forces. So we had Army, Air Force, and Navy back in 2010 when we first started this symposium, and then Excelsior had asked myself and Rob Lim to be able to use that formula to generate the Excelsior. So there's a really early genesis and association between the two organizations. Also to share with the Excelsior, there's a lot of opportunities. We're getting a lot of support from the American College of Surgeons with the Excelsior. So there's the M curriculum that's been developed. It's free. It's a curriculum that supports austere environments and rural surgery. It's related to that. We just recently were able to post a military surgeon module on the practice management employed surgeon section. And when I hear just at the advocacy and leadership presentation this last weekend, in DC, I was virtually participating. But Patricia Turner, the executive director, was talking about this partnership, ACS, Military Health System partnership, and the importance of it. And I keep hearing that from the leadership level of ACS. So it's really good. It's a really good organization to be a part of. So just to share a couple other things that Excelsior offers, and then to talk about the synergy between these two organizations. There's a webinar series that each of the committees offer. This Friday, there's an astronaut, there was a SEAL, there was a doctor, Johnny Kim. So I think he walks on water. 2 years ago, he actually was a speaker as part of our surgery in space panel we had at SAGES 2 years ago. He's speaking this Friday. So, and there's other webinar series I talked about. Going to Excelsior, you interact with, it's an on-ramp, off-ramp, it's a home. So surgeons that are coming into service, junior in service, in the middle of service, leaving service, you're able to talk to different surgeons about their experiences and so forth. So it's really grown into quite an opportunity. So how these two organizations relate, I think as time goes by, you go to Excelsior and it is pre-trauma focused. It's American College of Surgeons, it's more kind of structured and formal to the most extent. And you are in touch with the consultants, as I said. So that's your chance to have hear them speak and have a chance to ask them some questions on the side, which I think is fantastic. I think it really, we didn't used to have that when I was a junior officer, so I think that's a real benefit. But then this society is a lot more malleable. Really, what the committee wants for this session is what you get. You don't have to go through this long approval process. And so as this committee evolves, global health engagement, different use of minimally invasive surgery techniques, different ways that this group wants to expand. Maybe that's with simulation or, again, different robotic use, different ideas. So I see the two as complementary, and they're about 6 months apart, so that's good. And I think that's largely, and then membership. I think there's one more slide. Let's see if Andrew pulled, QR code. All right, so that's just a QR code. I think that helps you buy some lunch or something. No, that's a membership. That if you can read QR code, that says membership in QR code language. So you just use your phone, and that's a chance to be a member. Now, why do you want to be a member? Well, then you get access to the symposium I talked about. Then you get access to the webinars, and you get access to that whole community. So it's important for particularly active duty to be aware of this society. I hope this isn't the first time you've heard about it, but if it is, I'm glad we had the opportunity. So thanks, Andrew, for inviting me up here, and certainly I can answer any questions either now or on the side. If anyone has any questions now while I'm up here. All right, is the microphone working? Just kidding. All right, thanks. Appreciate your time.